So, understanding screening versus diagnostics tests, something every patient would know. Hey everybody, welcome back to the channel. I'm Dr. Mathai with Organ Health DPC, and today we're talking about something that affects all of us at some point, medical testing. Specifically, I want to clear up the confusion between screening tests and diagnostic tests. Have you ever wondered why we order certain tests even when you feel fine, or why a positive result doesn't always mean you have a disease? Hopefully, by the end of this video, you'll understand exactly what these tests mean and how to interpret results. So, let's dive in. So, to start off with, what are screening tests? Well, let's start with screening tests. Think of these as your early warning system. So, screening tests are specifically designed for people who feel completely healthy and have no symptoms. The whole goal is to catch potential problems before they become serious, before you even know something might be wrong. So, some common examples that you've probably heard of include things like mammograms for breast cancer, PSA blood tests for prostate cancer, and low-dose CT scans for lung cancer screening in high-risk individuals, so people who smoked. Now, what are diagnostic tests? So, diagnostic tests are different. These typically come into play when there's already a reason for concern. Maybe you have symptoms, or perhaps a screening test found something unusual. So, diagnostic tests are designed to give us a definitive answer. Do you actually have this disease or not? For example, if a mammogram shows something suspicious, the next step would be a biopsy. That's a diagnostic test that confirms whether cancer is truly present. And so here's where things get really important, and honestly, where a lot of confusion tends to happen. So let's break down what test results actually mean. So a positive screening test doesn't automatically mean you have the disease. It just means the test found something that needs a closer look. On the flip side, a negative test result means nothing unusual showed up, but it's not 100% guaranteed that you're disease free. Why? Well, because screening tests aren't perfect. Sometimes they give us false positives. That's when the test suggests you might have a disease when you actually don't, and sometimes we get false negatives when the test misses a disease that's actually there. I know. That sounds scary, but this is exactly why we have follow-up systems in place with diagnostic testing, right? So the other thing we also typically talk about is sensitivity and specificity when it comes to tests. The test quality measures, so now you might hear terms, your doctor might mention terms like sensitivity and specificity. Well, let me make it really simple. Sensitivity is how good a test is at finding people who actually have the disease. A highly sensitive test will catch most cases of the disease, but it might also flag some healthy people as being potentially sick. Think of it as a very cautious test. It doesn't want to miss anybody. Specificity is the opposite. It's how good a test is at correctly identifying people who don't have a specific disease. A highly specific test is great at reassuring healthy people they're fine, but it might occasionally miss somebody who is actually sick. So the ideal test would be one that is both highly sensitive and highly specific, but in reality, there's a trade-off between the two. So real-world examples would include, so let me give you some concrete examples so that this potentially makes some sense. So mammograms have high sensitivity, which means they are really good at finding breast cancer, but this also means some healthy women will get a false alarm and need additional testing. So that can be stressful, but it's better than missing a real cancer. PSA test for prostate cancer is another interesting example. So about 8% of men will test positive, but here's the kicker. Of those positive results, only about 18 will actually have the cancer, or 18% will actually have the cancer. So 1.4. That means the vast majority of men with a positive PSA need more testing, but ultimately don't have cancer. Low-dose CT scans for lung cancer find early cancers, which is fantastic, but they also frequently find harmless spots in the lungs that need follow-up. So this can cause anxiety, lead to more tests. But again, early detection is really what we're looking for. That's really what we're trying to do, right? Now, here's something that surprises a lot of patients. If a disease is rare, even a really good test can have more false positives than true positives. And this is exactly why doctors use a two-step approach. So screening first to narrow things down, then diagnostic test to confirm. It's not about putting you through unnecessary tests. It's really trying to be as accurate as we potentially can, right? So let's recap the key takeaways. First, screening tests are for those healthy people and help catch disease early, but they're not perfect, right? They're the first line of defense, so to speak. Second, diagnostic tests are the confirmatory step. They tell us for sure whether the disease is present. And then third thing that we talked about, positive screen results don't mean you definitely have the disease, and negative results don't guarantee that you are disease free. So this is why it's important for us to follow up. And finally, as always, I can't stress this enough. Always discuss your test results with your healthcare provider. Ask questions like, what does this test mean for me specifically? What are the next steps? What are the chances this is a false positive or a false negative? Your doctor should be able to guide you. Really that's what we're there, to guide you through this process and help you make informed decisions about your health. I hope this video helped clear up some of the confusion around medical testing. Understanding these concepts empowers you to be an active participant in your healthcare journey. If you found this helpful, please give it a thumbs up and subscribe to the channel for more patient educational content. Drop any questions you have in the comments below. I'd love to hear from you. Remember, knowledge is power when it comes to your health. This is Dr. from Mathai with Oregon Health TPC, and see you guys in the next video. Have a good one.